beginning of 2014, myself and the doctors had a good look at the way our urgent booking system works. Up until then we'd had a variety of appointments, so the main ones were ones you could book in advance with your specified doctor, and then anyone who felt they had an urgent need for that day would go through the triage nurse. The triage nurse's phone call list would be anything up to 90 or 100 patients on a morning.
Completely unmanageable. We couldn't cope with that number of patients in a morning. We didn't have the appointment system set up, whereas now hopefully we have the free appointments and we can manage to fit everybody in.
So what we have now is we have 2 doctors and a nurse who all work together as the duty team on the day.
And they'll be given a choice of either a face-to-face or telephone appointment with a doctor or a nurse, and that's at their request, so they can decide what they think would be most appropriate to serve their needs at that time.
The receptionists have a list of kind of where the calls would normally go. So, for example, minor illnesses are often seen by the nurse. An ongoing mental health problem may be appropriate for the doctor to talk to them on the telephone. A UTI, depending on who the patient was, so for example if it's just a normal patient, they may be able to be talked to over the phone by the nurse. They drop a sample in and then possibly be prescribed antibiotics. If they're pregnant or a child or anything like that, then the reception staff know to put it in with the doctor.
Effectively, we're trying to offer that choice of either having a planned appointment at a time that's convenient to you with the doctor or nurse that you'd prefer to see, or if a patient feels that they need something sorting out more quickly, then that can be managed through our urgent care service on the day.
The idea is it's always patient choice, so yes, normally certain things would go in with the nurse, but if the patient says to us, do you know what, I really want to see the doctor, then that's where the reception staff will put it in.
We've got lots of phone consultations in the morning, so you can phone up, have a chat with us, and we can decide together what the next best plan is.
There'll obviously come a time when we're at capacity, so we're fully booked for that day for the on-the-day appointments, and then we move into what's called critical care. The patients will get a new message on the telephone saying we are fully booked for today. If you feel that your problem is urgent for today and you need an urgent assessment by the doctor, then you can ask the receptionist. The receptionist will then take the message, they put down a telephone call for the doctors, and the doctors will then ring the patient back once they have a space in their surgery. Then as needed, the doctors will either bring the patient down, give them telephone advice, or book them in for the future.
And we then also have our routine appointments. They can be booked up to 4 weeks in advance, and that's at the choice then of in terms of time and doctor or nurse, at the convenience of the person wanting the appointment, obviously within the availability that we have. And we also have some what we call extended hours availability for that. So for alternate Mondays and Thursdays we have a clinic running till 8 p.m. Again with doctors and nurses, and we also have a clinic running every other Saturday morning between 9 and 12, and again those appointments can be booked in advance.